All right, diving in today, folks, we're going to unpack something pretty crucial, especially if you're a medical grad, with an Indian MBBS degree and you're thinking about practicing over in Germany. It can seem like a bit of a maze, so we've gathered all the official info on this whole Anerkennung process to help clear things up.
Yeah, absolutely. Think of this deep dive as your guide, really, to understanding how to get those qualifications recognized. Germany, they need doctors. And knowing the ins and outs of this Anerkennung thing, that's your ticket to actually practicing there and using those skills you've got.
Yeah.
So we're going to break down the big steps, the authorities involved, and even some of the hiccups you might run into along the way.
So first things first, what exactly are we talking about when we say Anerkennung?
Well, in a nutshell, it's basically Germany's official way of saying, yep, we recognize your medical degree from another country. They take a good look at your MBBS education, the training you've had, all of it, and see how it stacks up against the German standards. The goal is to figure out if it's essentially equivalent.
Got it. And who's the one doing all this comparing and evaluating?
Okay, so the main players here are the Landesprüfungsämter, the LPAs. It's a bit of a mouthful, right? Basically, they're like state-level exam offices. They're your point of contact for this whole Anerkennung thing, and each German state has its own. You're looking at a time frame of, say, 3 to 4 months for the process, but that's after they have all your paperwork.
So it's not just one central office. It's different depending on where in Germany you want to practice.
Right, exactly. Like if you're aiming for Berlin, you deal with the Lagso. If it's Hamburg, then it's a Behörde für Arbeit, Gesundheit, Soziales, Family and Integration. Bavaria has the Regierung von Oberbayern and so on. But don't worry, the German Medical Association, they have a list of all these LPAs on their website. Super helpful. And hey, if you're still in India, the Service Center for Professional Recognition, ZSBA, they can lend a hand with getting those initial documents sorted too.
Okay, that makes sense. So you found the right LPA. Now what? What are the big steps in this whole process?
All right, so first off, you got to formally apply. You send in your application to that specific LPA. You can usually find the forms online these days. They'll get back to you, confirm they got it, and let you know if anything's missing. Oh, and some states are even using online portals now. Makes things a bit smoother. After that, it's the Gleichwertigkeitsprüfung. It's basically the equivalence check. They really dig into your MBBS education and training compared to what a German doctor would have. And sometimes you might skip the step and go straight to the Kenntnisprüfung, which is the knowledge test.
And I'm guessing knowing German is a good deal here, right?
Oh, huge. Absolutely essential. You need at least a B2 level in general German. Recognized certificates like Goethe or Teststuff. But then for actually practicing medicine, you've got to have C1 level, specifically in medical German. And to prove that, you'll take the Fachspracheprüfung, the FSP. It's all about showing you can communicate in a medical setting. C1 level in medical German, it's the standard for doctors. And honestly, getting out of the FSP, those exemptions, they're really rare.
So lots of paperwork, I imagine. What are the key documents you absolutely need to have?
Okay, let's see. You'll need that completed application form, your passport, the original MBBS degree certificate, and your transcripts from uni with certified translations into German, of course. Then confirmation that you finished your internship, a detailed CV, and those B2 and C1 German certificates we talked about. And, of course, a medical fitness certificate and a police clearance certificate. Both of those have to be recent within the last 3 months. You'll also need a certificate that shows you're allowed to practice medicine in India, and one from your most recent medical employer, basically saying you're in good standing. That one needs to be recent too, within 3 months. And just so you know, some states might ask for a few extra things depending on the rules. Oh, and remember, for any document that's not originally in German, you'll need a certified translation and make sure you get those copies officially certified too.
Now, how can someone be sure that their medical degree from India, will actually be recognized in Germany?
All right, so for that, you've got to check out the Anabin database. It's at anabin.kmk.org. You can look up your specific Indian medical university there, and even your MBBS degree title under Institutionen and Hochschulabschluss. You want to see H plus war. That means it's fully recognized. But if your university is not there, or if it has a different status, you might need to get a statement of comparability from the Central Office for Foreign Education, the ZAB.
Okay, let's dig a little deeper into that equivalence check, the Gleichwertigkeitsprüfung. What parts of your education are they really scrutinizing?
Mainly, they're looking at what you studied, how long you studied for, and any practical experience you've had, like internships. They want to see that you've got that strong theoretical foundation and practical skills too. Often they pay extra attention to internal medicine and surgery, but they also look at things like emergency medicine, pharmacology, medical imaging, radiation protection, even the legal side of practicing medicine in Germany. Having detailed syllabi from your MBBS courses that can really help here.
And what are the possible outcomes after they've done this evaluation?
So there are three main ways this can go. One, full recognition, you're good to go. You can apply for your full medical license, the
Yeah.
approbation. Two, partial recognition. This means you'll need some extra steps, what they call Ausgleichsmaßnahmen, like
Hmm.
compensatory measures. Could be the Kenntnisprüfung, or maybe some adaptation courses. And three, well, no recognition. In that case, you might have to do some more medical training before you can try again. But whatever the result, they'll send you an official notification. It's called a Bescheid, with all the details.
And if they do find some gaps, what do these compensatory measures, these Ausgleichsmaßnahmen, usually look like?
Well, the most common ones are the Kenntnisprüfung, which tests your medical knowledge, and then adaptation courses, which are basically targeted training for anything specific they think you need to brush up on. Sometimes they might even suggest a refresher training program. And just so you know, even if you're missing some documents, they might still make you take the Kenntnisprüfung.
So tell me more about this Kenntnisprüfung. What's it like?
All right, so it's a mix of practical stuff and an oral exam. They want to see that, your stuff across a whole bunch of medical subjects, to the level of someone who graduated from med school in Germany. They often focus a lot on internal medicine and surgery, but it covers other areas too, like emergency medicine, pharmacology, imaging, radiation protection, and medical law. The clinical part, they might even have you do a patient presentation, and usually lasts about an hour, hour and a half. They'll grill you on diagnosis, treatment plans, medical ethics, maybe even have you show off some clinical skills. You usually get 2 chances to retake it if you don't pass the first time. It's organized by the Landesärztekammer, the State Medical Chamber, and trust me, you want to be prepared for this one.
Is there any way to get out of taking the Kenntnisprüfung? Like, are there exemptions?
Well, there's a chance, but it's pretty specific. If you've worked as a doctor for at least 3 years in another EU country where your qualifications are accepted and it's all certified, then they might waive it. It's really up to them, though. They basically decide if your work experience or other skills you can prove you have make up for any differences in your initial training. But you've got to have all that work experience documented really well.
Okay, so let's say you get that Defizitbescheid, the notice of deficiencies. What's that all about?
So this is the official letter from the LPA, where they list out all the spots where your medical education doesn't quite line up with the German standards. Could be theoretical knowledge, practical skills, anything really. It's kind of like a roadmap. It tells you what you got to do to get to full equivalence, maybe more training, specific courses, or even those exams, the FSP and the Kenntnisprüfung. And this Bescheid, it's really important if you need to apply for a visa to do those extra qualifications like a Section 16 visa. They might also recommend doing some practical training at a recognized hospital here, passing that FSP, taking adaptation courses, or, tackling the Kenntnisprüfung.
Now, what about the Berufserlaubnis? That's like a temporary medical license, right? How does that factor in?
Exactly. It lets you work as a doctor in Germany, but under supervision, while you're still working towards getting your full approbation. To get it, you usually need your medical degree from back home, proof that you passed the Fachsprachprüfung. And a lot of times, they'll also want a confirmation that you've got a job lined up. But it does come with some limitations. You have to work under the supervision of a fully licensed physician. Usually you can't be self-employed or be in a managerial position, and it's only valid in the state that issued it. It's a good way to get some experience and start earning, though.
And how long does this Berufserlaubnis last?
The longest it's valid for is 2 years, but they might extend it in some cases if you run into some really tough circumstances or if there's a big need for doctors. But extensions aren't guaranteed, and they might come with conditions like showing that your medical knowledge is up to par or maybe restricting you to a specific specialty. Also, it becomes invalid if you fail the Gleichwertigkeitsprüfung or the Kenntnisprüfung. And depending on the state, that initial validity period might be shorter, like 6 to 24 months.
Now, if you're working with a Berufserlaubnis, does that time count towards specialist training, to become a specialist?
Unfortunately, not usually. To get into specialist training, you generally need that full approbation. That's because it shows that your medical knowledge matches what a German graduate would have. Remember, basic medical training in Germany is at least 5 years, and the approbation is basically the official recognition of completing all that. So if you want to work as a resident in assistance arts, You usually need the full approbation, not just the temporary license.
So just to hammer it home one more time, those German language skills, they're really make or break, huh?
No kidding.
Hmm.
You got to have that B2 level for general communication and the C1 for medical German, the one you approved through the Fachsprachprüfung. And you need to show proof of both levels throughout this whole Anerkennung process. It's not just about paperwork. Being able to talk to your patients, write everything down properly, and work well with other doctors. It's all about that language. And yeah, we mentioned it before, but getting out of that C1 medical German test, it's not easy.
All right, so for anyone listening who's going through this, remember the big picture. The Anerkennung process, it might seem like a lot, but it is a structured path. Focus on understanding how they assess your qualifications, get that German up to speed, especially for that FSP, and be organized with your documents.
And don't forget the first steps. Head to Annabin, see where your university stands, and then find the LPA for the state where you want to practice. Their websites are your best friend for the most up-to-date forms and all the specific requirements.
Absolutely. And remember, Germany needs more doctors. If you put in the work, prepare well, and don't give up, you can definitely make it happen. Think about what part of this process you need to tackle first and get started.